we introduced Point of Contact, a serious game that aims to educate and change perceptions of coronavirus and associated prevention measures. COVID-19 has been an unprecedented event, impacting all communities around the world. Most information provided to the public on how to stay safe comes in the form of TV broadcasts or lengthy text-rich websites or articles. This has to compete with misinformation. The situation is complicated by asymptomatic cases, leading to wider spread. We were motivated by the question, how do we engage individuals, shift their perceptions of the seriousness of the pandemic, and alter their behaviour about following preventative measures? We address the challenge through the lens of serious games. Serious games provide a safe magic circle to apply information firsthand to experience the impact of the actions. They can also trigger the game transfer phenomena, as altered perception or heightened awareness towards targeted real-world activities. The design challenge is to build a magic circle with the explicit learning objective of how COVID-19 preventative measures affect the day-to-day life of an individual. Pandemic by Z-Man Games is a de facto standard for pandemic-related serious game discussions, but is complex and the game map is the whole globe. Point of Contact is a complementary offering with a magic circle designed at a microcosm level like an office floor, supermarket, or an airport terminal. We also need to flatten the learning curve and maximise reach of the game for the target audience. We drew inspiration from Inner Sloth's Among Us and modified the gameplay to support our objectives. As part of our redesign, we removed the imposter aspects from Among Us. We retained other aspects like tasks and movement mechanics. We set the locale for the game as an office space, and the game was implemented using the Godot engine, allowing browser-based play. In Point of Contact, the player is an office worker completing jobs during the workday like in real life. Completed jobs increase the collaborative economy score. One of the players starts the workday with COVID-19, bringing it into the office environment. COVID-19 can be spread through close contact with infected players, as well as interacting with tasks after an infected user has performed them. In this way, the transmission attempts to mirror real life. A player can be asymptomatic, showing no symptoms in game, or symptomatic, resulting in a reduced movement speed to make it clear to the other players that you contracted the virus. Spreading COVID-19 can be reduced by completing optional tasks which are based on the government guidelines for preventing transmission, such as wearing masks, sanitising hands, social distancing, and opening windows. Players can also use testing stations to check if they have COVID-19 and are asymptomatic. This creates a moral dilemma for the player, as they can be voted off to be quarantined, but in doing so can no longer contribute to the group's economy score. The game ends with the end of the workday. At the end, the players are shown a health score based on the proportion of uninfected players, and the task based on economy score. It also shows their infection status, and if they spread COVID-19 to other players. We ran a study to see if a serious game actually produced any game transfer phenomena apparent through the altered behaviour and perception towards COVID-19 preventative measures. The 23 participants played the game in groups 3 times and answered questionnaires after each. We also recorded the game logs to track their actions, interactions and events. The results showed that the participants had prior awareness of most measures. However, their perception of risk of infection had changed post-study. Many indicated plans to follow the preventative measures more strictly. There were some surprising results too. For example, players vastly underestimated how often they were breaking social distancing rules and did not follow the guidelines well. We also saw the participants perform more of the optional preventative measure tasks. The most interesting outcome was an altered opinion about the importance of lives versus livelihood, i.e. individual health versus economy. The pre-study opinion was based with a slight skew towards health. Post-study, the opinion was skewed drastically towards health, doubling the number of participants considering individual health most important, and only 13% of the participants assigned some importance to the economy. We can conclude that the learning objectives of Point of Contact were achieved. Reflecting on the design journey, we recommend the following. Attempt to adapt an existing magic circle if possible. Actions related to learning should be a choice and not an imposition within gameplay. Explore if probabilistic modelling can be applied to the emergence of learning objectives within the game. For a detailed discussion on how Point of Contact can be generalised beyond the COVID-19 context, please refer to our paper.